My Lords, since coming here 10 months ago, I've read a lot of legislation and reports, and to be honest, it's all been a bit of a chore. However, this report sparkled, and I know it's had lots of plaudits, but can I just commend Baroness Armstrong of Hilltop and all the Public Services Committee for an accessible, informative and thought-provoking document. There's lots I disagree with, but it was just so useful and unusual for these toxic times that it was free from rancour and gotchas. And as it says itself, it's not about apportioning blame for past failures, but making constructive suggestions for future reforms, a great relief. One caveat in general, I'm wary of any sphere allowing the normals of the pandemic to automatically become a new normal by default. The call in the report is to lock in innovations, but that makes me nervous. Yes, it's very useful to kickstart debate, but not to institutionalise as a rigid fait accompli. So, for example, we all know that digital technology may have facilitated everything from working from home to digital health consultations. But as the report itself points out, Zoom, Teams, etc. would never and should never replace face-to-face services. But I do note with concern that too many GPs and, for example, university lecturers or senior managers seem reluctant to resume real-life interaction at the expense of service users. One striking feature of the report that I'd like to make explicit is the cost of treating the NHS as almost a sacred cow public service. I mean, it's understandable to celebrate and almost sacralise the health service in a health pandemic, of course, but this can be at the expense of other services. Testimony in the report noted that support for the NHS, especially during the initial part of the pandemic, might have been necessary but should not have come at the expense of preventative and public health services, and I agree. And the Nuffield Trust is quoted noting how the COVID crisis highlights the startling inequality between health and social care services, and I think many of us felt uncomfortable that that initial clap for the NHS neglected care workers. And even now, today, all the focus is on a pay rise for the heroic NHS staff, whereas social care is plagued with poor wages, awful conditions of employment, and now we've even singled out social care workers as the only workforce facing mandated vaccines or face the sack. So I think it's important that the report highlights that long before COVID, successive governments prioritised funding the NHS, acute services especially, and neglected funding social care. The Nuffield Trust notes that the NHS received generous emergency funding from the Treasury at the early stages of the pandemic, which enabled a dramatic expansion of capacity. But care providers, in contrast, said that extra funding did not reach them. Also unrelated, the Deputy Director of the new local government network contrasted the experience of local government with the NHS, and the NHS, which had its costs met in full, deficits written off unquestionably, but that was a privilege not afforded to councils or other public services. And I do wonder about this hierarchy of priorities. And the consequence goes beyond material funding. As ADAS points out, the historical tendency to prioritise the NHS has influenced policy decisions, sometimes with tragic consequences. In the names of saving the NHS rather than the NHS saving lives or the public, the collateral damage of non-COVID deaths of cancer and heart disease and the huge waiting list for many in dire need of medical interventions is something we face now, with a terrible news of an increase of 50% of under-20s hospitalised with eating disorders. And also we heard this morning in a different debate about the use of do not resuscitate in hospitals. We can't ignore these things. But perhaps the greatest horror associated with a focus on the mantra of protecting the NHS was the scandal of patients being discharged from hospital into care homes without testing. What the Nuffield Trust says, and is quoted in the report, a rapid clearing of hospital beds in the early stages, regardless of the lack of preparedness in the care setting. The most vulnerable died as a consequence, and at the very least it is important that we need to be able to query NHS policies without being shut down as somehow disloyal to NHS staff who, I agree, have been and are heroic and hard workers, but so are other workers. and I don't think that if you query it, you should be called a traitor to the institution. Another striking aspect that I read into the report, or from the report, is the wasted potential of civil society in helping deal with the pandemic. On a positive note, of course, the report gives lots of examples of innovation happening because bureaucracy was swept away. In fact, sometimes tear up the red tape is caricatured as a laissez-faire, careless approach. But the removal of overly bureaucratic hurdles did allow public services to work alongside charities and community groups, and volunteers and the private sector stepped up. And this altogether played a huge role in delivering services. The surge of civic action, such as the 4,000 COVID-19 mutual aid groups, the local WhatsApp groups and Facebook groups, I'm sure we were all in as volunteers, showed a real appetite for providing practical solidarity in the emergency from so many people. We saw the generosity when 750,000 signed up in 4 days when NHS England's Royal Voluntary Service was launched in April 2020. But sadly, that was wasted. The Institute for Volunteering Research rightly notes that in the report, the over-centralised coordination was not aligned to locally organised activities. Significant time was taken to respond. Actually, enthusiasm dwindled, people became demoralised. And I think it was just so sad when volunteers could have helped, for example, relieve the pressure on social care workers or indeed on NHS workers. And in general, the official approach to COVID was to demobilise the public, to squash initiative and voluntarism. The report notes how the German Public Health Service, in contrast, mobilised and seconded public servants from across departments, forestry, museums, swimming... Oh, sorry, I've gone on.
Afraid that her time is out. Yep.
Thank you. I apologise. I am sorry. I hope that we can mobilise the public in the future, but thank you for the report, and I do apologise to the House.